Thank you, Mr. Chair. And as a new ranking member in the Public Health Committee this session, I have learned so much and really appreciated the experience, insight, and the leaderships of Chairman Abrams and you, Representative Steinberg, and my fellow ranking members, Dr. Pettit and Senator Summers. And the work that we do in this committee is extremely important to Connecticut residents, especially during these insidious and challenging COVID pandemic times. And I do agree with you, Mr. Chair, that the emotions and the personal attacks has no place in the legislative process for the work that we are all striving to do. And I came into this vaccine on religious and personal exemption debate with a real fresh perspective. As a new member, I was kind of hopefully unvarnished by the tumultuous past and passionate, heated debates. And hopefully with an open mind and cognizant of the important duty that we have as legislative leaders in this committee. So let me be emphatically clear. My children, now 26 and 22, received all the required vaccines during their school experience. I believe and support vaccines. I have received my COVID-19 vaccine and encourage everybody else to do so. I genuinely believe in the science of vaccines. As the co-chair, along with Representative Steinberg of the Connecticut General Assembly Bipartisan Bioscience Caucus, we understand the contributions and the improvement to public health and a better living occurs through our bioscience initiative. So I support our bioscience companies and their scientific innovations. And a great example of that is the COVID-19 vaccine by Pfizer that's created right here in Connecticut. And again, and taking the vaccine, I'm grateful and relieved, okay? COVID-19 has impacted my perspective and so many others on public health and has done so many different things from a standpoint of changing our perspective, as Mr. Chair laid to. But this bill is not related to the COVID vaccine or the COVID pandemic. It is critically important for people to know that House Bill 6423 and Senate Bill 568 are identical bills, and they're strategically designed to go to both chambers of the General Assembly. And it has nothing to do with the COVID-19 vaccine. It's important for people to know that, because unfortunately, sometimes in the broader dissemination of this information, we're tying it to people who may or may not object to this, to the COVID pandemic concerns. The focus of these bills are on the elimination of religious exemptions from nearly 70 plus immunization requirements for children that are going to be attending public and private schools, including our higher education institutions, which we not heard a lot in our testimonies, and also child care centers and groups, including family daycare homes. You're going into people's family daycare dynamics where state government is having an impact on those type of gatherings. And as I said earlier, I came into this issue with an open mind. And I just simply want to offer my observations leading to today's vote. And let me be clear, these are my thoughts. First and foremost, the process. Our chairs, who I've grown to genuinely enjoy working together with, control the agenda. And these bills became an overriding goal of this committee to do, regardless of the opposition, the views, and perhaps some merits of the arguments. It seemed the fate of these bills were predetermined, leading to some who would even say that it was a rigged process all along, and the opposition never had a chance. I genuinely hope that was not the case. But unfortunately, the legislative process, despite the challenging COVID and Zoom meetings, did raise some flags to me. I want to talk about some of them. One, the limitation of public hearing to 24 hours, leaving nearly 1,800 people's voices unheard. Although I know the insistence that we could read the testimony, and I did indeed read the nearly 3,500 submitted testimonies, it just was not a transparent process of having people's voices be heard. It is controversial, but again, process. The second, the coincidence of expert representatives from our state's public health and education departments whom both were not available during the public hearing to address relevant questions from committee members. In fact, we have yet to receive answers from either department on nearly 4 pages of public policy implication questions. This kind of delay, this kind of coincidence is raising questions to me of what are people not willing to answer? The belief of so many disenfranchised residents who felt their voice and deeply held personal body decisions were not respected or heard is quite evident in this process that I noticed and experienced. Now, I understand that there's a greater public health consideration to these bills, and I'm fully conscious of them, from the fear and the contagious spread of infectious diseases, especially during this COVID pandemic. And despite the chair's citation of incontrovertible facts toward the greater public health, I wanted to cite one public testimony that had an impact on me. I was very impressed by the testimony of a strong advocate of these mandates, Dr. Ross, who responded when asked during the public hearing we had, do the current immunization rates pose an imminent public health risk? His answer was an impactful no, despite his reinforced support that these mandates and a greater awareness and education toward vaccination is essential. It's important to note that because what is being cited has a urgent, immediate public health risk was not truly evident, and we don't have the data to support it. The other fact is, if we're looking to grandfather particular children, does it not counter to the argument of the sense of urgency and the greater public health risk? So for those of us that are looking to grandfather it as a compromise, it defeats the argument of the urgency and the risk that is being purported. Ultimately, I can't support either of these vaccine mandate bills because for me, despite my own personal belief in vaccines and the constant theme of greater public health, as I said in the earlier part, I believe in vaccines. I believe in vaccinating my children, but these are my decisions. We must balance those kind of greater public health concerns that's cited by the chair and advocates of these bill with personal body choices, that the decision as to what to inject into themselves and that of a parental right to do what is in the best interest in their mind for their children should never be overreached by state government. For those of us that believe in personal body rights, such as a woman's body choice on abortion rights, 2, an individual's right to dignity and death decisions, we have said that personal body right decisions needs to be balanced with the state control and mandated for the greater public good. So for that reason, I'm guided by these principles of individual personal body rights and encourage that we should educate and raise awareness toward the greater public health benefits and concerns and alleviating the risks. But to deny a child and their family the opportunity to receive an education, which is a Connecticut constitutional right, is an overreach of state control, believing and citing that state bureaucracy and political leaders know better on how to protect and parent childs. So enough said on that. As you will see in this debate, there are not a lot of questions being asked. The debate has been full-blown and visible, and feelings are pretty well entrenched. But I want to thank Mr. Chair and my committee colleagues for the opportunity to share my thoughts. And as we're about to definitely end March with a lot to think about into the rest of this legislative session, I ask that this is not a Democrat or Republican issue. It really is a balance between whether the state ultimately in their belief in what they're doing is in the best interest of the greater public good overrides the personal and body choices of parents and individuals. So I will not be supporting these 2 mandates, but I felt it was important to share that it should not be construed as being an anti-vaxxer, in being a lack of concern and awareness for the greater public health risks, that we're currently in right now and any future health pandemics that we may have. But we have an important balancing act to maintain here. And I hope that we will pause and deliberate and create better solutions that incorporate everybody's perspective into this. Thank you, Mr. Chair.
Thank you,